All right, good morning and welcome to Morning at NTV. This is Everyday Life and my name is Idris Matun. Now, we are talking about fertility and infertility in men and women. And in studio, I have a very beautiful lady, Rasha Kelej, doctor.
Thank you very much
You are
for having
welcome
me.
to the show.
Thank you very much.
So, tell us about yourself.
As you see that I am from Egypt and of course I'm African woman. I'm pharmacist by education and currently I am the CEO of Merck Foundation. Just to give an idea about Merck Foundation to the audience, Merck Foundation owned or the first foundation owned by Merck KGaA Darmstadt, Germany, which is the oldest pharmaceutical and chemical company in the world.
Oh, wow.
Established 350 years ago.
350
But the foundation
years.
is still new. So the foundation is 1 year ago.
So the foundation,
yes.
What is the foundation doing?
The foundation has a mandate of building healthcare capacity in Africa and developing countries and also improving access to quality and equitable healthcare solutions and empowering women and youth in science and technology. Okay. So basically with a vision to have everyone leading a healthier and fulfilling
life.
Yes,
so
fulfilling lives.
Now, fertility and infertility is a very tricky subject for most of us. And you wonder, you keep on wondering, am I fertile and am I infertile? How are you handling this, especially in Uganda?
Look, I mean, the mandate of the foundation is simple. We don't, of course, treat people, or it's all about raising awareness about infertility prevention and infertility management and male infertility, because you know that most men are blaming only the wives for being infertile. That's why I said it's tricky. So having you today with us, you have to be our advocate through your own programs that men are responsible for infertility as much as women, equally 50%, and they should support their wives. And they should not consider infertility as a stigma or a taboo at all, because it's a condition and it can be prevented and also can be treated easily. And with supporting his wife and joining the journey of the treatment, they can have a very happy family. But without that, it will be only a stigma and a taboo and disaster and a lot of violence and discrimination. And all this through a very, very important campaign, and has also a very interesting name, Merck More Than a Mother.
Okay.
More than a mother. Why? Because we're saying to all the women, you are more than just mothers. Yeah. So even if you don't have children, you're still a human being and a woman, and can be a productive member in society. And we are calling all the men and women to respect and appreciate other fellow women, whether they have children or not. It's very simple.
So infertility, how do I tell that I'm infertile, or my wife is infertile, or myself, I am infertile? How can I tell?
I mean, you cannot tell until you get married, and then after you have marriage without babies for 1 year or 2 years, you should go and check to the doctor with your wife, because there is some small intervention can be made. Even you could not yet be infertile, but some small intervention can be done to help you to have a baby quicker. And then if you have a problem with infertility, either surgical problem or hormonal problems, can be of course addressed and treated with many ways, many methods.
So many couples, when they are married and they spend a little bit of time without kids and all that, of course men will start blaming the women. You are infertile, blah 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 blah.
Exactly, which is not right.
Which is not right
at all.
But now the question comes, is there a remedy? You say there's an intervention.
Interventions and techniques.
What are these techniques?
I cannot talk about them now in even 1 week, because there's too many things. Okay, the idea and the trick is you go to the doctor with your wife and get tested for infertility, and they will tell you there's a long list of tests that can be done, and if a small thing is missing, they can add it, or they can change the whole technique by in vitro insemination or IUI. There's too many things. It has to be explained one by one, case by case to the doctors.
individuals.
But what we can talk about now, which is can be a message for everyone at home, is that 85% almost of the infertility cases around us can be prevented, which is a very high number, because it's due to untreated infectious diseases, which is resulting from what? From child marriage, genital mutilation, unsafe abortion, unsafe delivery, STDs, all these things we are advocating against every day. Complication of these things can be infection, which is cannot be can mostly not diagnosed in the right time, since 14 years old and 15 years old, and manifest in the body of the women or men, because also the STDs can manifest in men, and cause them infertility as a complication. And this is not a talk, it's a science, and 85% of the cases, mostly of the people in the reproductive age, due to this infectious diseases. That's why prevention is very important. So talking to youth and adolescents and young people, please have a regular checkup, safe sex, and avoid risky, and avoid get married and avoid risky behavior, because it's not both.
So you talk about checkups, going for checkups and all that. Can I just go to any general hospital or clinic?
Yes, general checkup can be in any general hospital, because this is a prevention. So if you have any problem in infectious or whatever, infectious diseases can be treated early enough, so it does not continue to be for infertility. This is very important. So prevention and regular checkup can be everywhere. After marriage and you don't have children for 1 year and more, then you have to go to the gynecologist to have regular checkup. And when it's very complicated cases of infertility, you can go to IVF center, of course, which is a specific center for high technology insemination and in vitro fertilization. All
right. So I presume you are best in Egypt?
In what?
Where you live?
Best in
Egypt?
I'm based in Egypt. No. I am not based in Egypt. Actually, I am from Egypt, but I am based between Germany and Dubai.
Ah, okay.
Because you know our foundation is a German.
All right. Yes. Now, Merck Foundation in Uganda, how do women and men access the foundation?
We have, of course, our website, www.merckfoundation.com, and I hope that your colleague can put on
Josh.
online. And of course, you can contact us through information@merckfoundation.com. So the email and the website can be addressed. So of course, as soon as you go to the website, you can contact us, and then we will be in touch with everyone. So anyone has a problem and a stigma, or want to share their stories of community mistreating them, or husband, or due to the stigma, we will target this community and try to raise awareness about, you know, breaking the stigma of infertility.
Yes, infertility. Yes. Wow. Thank you for coming on the show. And again, you look lovely.
Thank you very much.
Now, we have been talking about fertility and infertility. Be aware. Go and have a regular checkup. Be sure that, you know, you're good, and don't blame your wife. It's wrong. We shall
definitely don't blame your wife at all. But I want also to tell you that Merck Foundation not only doing, of course, infertility, as we said, that we are also having a big program about cancer access program, where we train doctors to be oncologists.
Oh wow!
And you know that, of course, cancer or oncologists, very few numbers of Africa, limited number, and this is a challenge definitely to improve cancer care. So that some patients are even not have the time or the opportunity to reach to be diagnosed, because the lack of oncologists around the Africa. So what we do is we partner with ministries of health and first ladies' offices to propose for us candidates who they think that they are suitable to be oncologists, and they're going to be working in the public sector after the training, so to improve access to
Are you doing that in Uganda?
In Uganda as well, definitely, we have a few candidates at the moment. They are actually at the moment in India getting their 1-year training of oncologists, and this is in partnership with the Ministry of Health, and specifically with Honorable Sarah Obendi. She is Minister of General Duties of Ministry of Health, and she's our partner, and she's also the ambassador of Merck More Than a Mother to raise awareness about infertility, and she's doing great job and during the among the communities and women. And now people before, they were actually don't want to speak about it, but now they are approaching us from everywhere and approaching her and want to have a solution.
It's no longer a taboo to talk
no,
about
actually,
it.
and I'd like to invite you as a media to be partner in this, because we had this partnership in Kenya and in Tanzania. People listen to media, and media enter every house, and if you start to talk about it as normal thing and repeating talking about it and removing the stigma and sharing stories of the discrimination and suffering of women, what's happened? The community will change because they see what they have done is wrong.
Well, as a leading TV station, we cannot turn down that opportunity.
You're recruited already.
Thank you. I will. All right, then, as we run out of time, any last few words?
I would like to thank you very much. I'd like also to call everyone who is listening to us today, just take the first step and approach your community, your family, your neighbors, and spread the word of that infertility is not a stigma, it's not a taboo, and there is a solution always. Respect your wife, respect all the women, whether they have children or not.
Yeah, and don't blame your wife for infertility. Well, we can continue the conversation on our website, www.ntv.co.ug, or Facebook, that is Morning at NTV, or NTV Uganda. You can talk to me on Idris Matu, that is Facebook, Instagram, Twitter. Well, Masuzamte is coming up next. Have a very good morning.